on the age of virtual health. So as you join, we're certainly glad to have you. Okay, well, welcome everybody. Thank you for joining. My name is Tim. I'm with Wowza Media Systems. As you've probably figured out by now, we're hosting a webinar today, and you've went through the process of registering. So we certainly are grateful that you're here to participate in this discussion. You should see the slide presentation as part of what we're talking about today. And the topic, of course, is the age of virtual health from first responders to patient monitoring. So we're very excited and looking forward to covering several topics today as we reflect on this topic and some things that we've done at Wowza in the last several months to support. So as we get started, let's go over an agenda very briefly. Of course, we're going to introduce everybody, talk about telehealth, telemedicine, virtual health streaming success requirements. If you're here and you're interested in streaming, you're probably wanting to be successful at that. So we're going to cover some tips and some suggestions there as per usual. We definitely like to leave people who attend these webinars with something they can take with them and apply to their streaming workflows. And we're looking forward to talking about some real world use cases. We have a few use cases that we're proud of, and they're exciting. And one of them in particular is just extraordinary in how it's impacting 911 calls and emergency first responders. And then what's next for virtual health? So it's about a 45-minute presentation. One thing that we do appreciate is you participating in the Q&A. There's a chat in the meeting tool that you can ask questions. Feel free to ask a technical question. We have two very capable support engineers standing by to answer any question that you have, and we're very, very appreciative for them being here. And then at the end, we'll actually review some of the Q&A and talk about some of the questions that you may present. So with that being said, let's go ahead and introduce. I've already introduced myself. I'm Tim Doherty. I work with sales engineering here at Wowza. But the other gentleman on the call, why don't you go ahead and introduce yourself?
Sure. Barry Owen, VP of Solutions Engineering here at Wowza, and happy to be back.
I'm Anthony Lazaro, Senior Director of Product at Wowza. Really excited for the conversation today. Excited to do the webinar with Tim, favorite webinar host. So looking forward to it.
Well, we've got a couple other support folks on the call. Of course, we have Jason Tukler and Mac Hill who are on the chat. So they're probably already busy typing answers to your questions. And then there's another gentleman you see in your, I want to say the left side of your screen, but it could be your right. I don't know. Justin Miller, who is our brainiac behind the webinar presentation. Let's go ahead and jump in. What is telehealth? We've got a few bullet points here. Telehealth is defined as the use of electronic information and telecommunications technology to support long-distance clinical health care, patient and professional health-related education, public health, and health administration. It also encompasses all health-directed activities that incorporate telecommunication strategies, a lot there, and it can cover anything from mobile health, video conferencing, which we're laser-focused on here at Wowza, remote patient monitoring, and a concept called store and forward. So, gentlemen, we've nailed a couple of definitions here. What do you think about telehealth? Any comments? Just anything you'd like to add to fill in the gaps?
I certainly think in the past 2-3 months, this is obviously increasingly relevant with lockdowns and quarantines and things like this, and people needing to be able to get health related services remotely. And a lot of these customers we're gonna preview today were well underway before that, but as this pandemic begun, they became even more relevant, and we're able to expand their offerings and really make a huge difference in a variety of ways. So I think kind of leveraging that as a kickoff point, I think it's really going to change things as we move forward. And I can just see it growing much more from here.
Yeah, echoing that, I think that the comfort level with telehealth is, greatly increased just from the last 2 months alone, from the standpoint of users' willingness to use it, to even service providers rethinking how they need to be handling these solutions, how they need to be deploying them, et cetera. So it feels like it's a real turning point in terms of just acceleration for a lot of stuff that has been going on for a while, but getting accelerated behavior because of just cultural dynamics as it relates to just adoption and familiarity, et cetera.
Yeah, I think we'd all agree, and your comments certainly lead to the next point, which is telemedicine. It's on the rise. I can tell you, as is just in my private life, my own healthcare provider has been aggressively inviting me to participate in meetings with my doctor over mobile technology. And it really does allow healthcare professionals to evaluate, diagnose, and treat patients, as we have in the first bullet point, from a distance using telecommunications technology. And I have to be honest with you, it's exceptionally convenient to not have to drive to the doctor's office, go in there and go through all those steps. So let's talk a little bit about just some of the factors we've seen. They're anticipating physician shortages. There's going to be more people, more demand. So that's not a good ratio that we're looking at. There are continued advancements in technologies, and there are even policies that are governors. So with these factors that are coming, what are you seeing just in general in our space or in video in general, how we might be able to get involved with some of this to support?
One of the factors I see is really interesting is the ability to expand services into underserved areas. So obviously in more remote places or less developed countries where you have a high population base, but not a lot of skilled physicians available, and you can really leverage the physicians you have, whether they're in the country or potentially out of the country. And, it makes a huge difference in these underserved areas. And one of the case studies we'll talk about is kind of in the sweet spot of this. And that, along with some of the technologies adjacent to video with better telemetry and being able to process data alongside the video and monitor things. Obviously in any kind of given hospital environment, there's a ton of data around. Being able to effectively take advantage of that and present that to a remote physician, a nurse, whoever, who can make decisions, I think is very interesting, and I think we're seeing a lot of that.
Yeah, I think the two other things that I would call out too is there's really both a customer experience standpoint that can be really better served via telemedicine. And then there's also just tons of operational efficiencies. And we'll see a little bit of both in some of the case studies we talk about, but from improving your patient care, satisfaction, we're all extremely conscious about germs and transmission right now. And just the idea that I could get some level of care of, do I need to go in and see you or not via telemedicine? That's amazing. It reduces exposure. As you said, it even saves you time in terms of your effort to go back and forth and, leave your job or whatever you would need to do during this appointment time. And then from an operator standpoint, there's tons of efficiencies that can be handled by having just better, monitoring of what's going on, better data alongside your understanding of what's going on. I think some of the names being mentioned below, being able to view ORs, operating rooms, and understanding when procedures are finishing, so that you could have the cleanup crew, right next to the room to get a quicker turnover. Like efficiencies like that, just being smarter and essentially modernizing and getting the whole healthcare industry into some of these more modern capabilities we have is just going to drive a ton of efficiencies, which is better for everybody too.
And also, from an individual physician or service provider perspective, I know my own physician has been able to take on new patients via telehealth that she perhaps couldn't have taken on before. So it's making her more successful. It's keeping it, it's letting her keep all of her staff on when maybe she would have had to furlough people. So there's a lot of, back to Anthony's point about efficiency, there's a lot of efficiencies, and there's really a lot of compelling reasons now for service providers to jump on board.
Yeah, it feels like telemedicine has come of age. We look at the crisis we've endured and continue to endure with the COVID-19, and I'm thinking about meeting technologies, but particular as we focus on telemedicine, it it has been one of many technologies that have helped tremendously us sustain a very difficult time where we're intentionally isolating ourselves. It's a comfort factor for me to, and you said it, Anthony, we're very germ conscious. We're trying our best to stay healthy and flatten the curve, as our leaders have said. And I like the fact that I can reach out to my doctor, make an appointment, and speak to them via virtual technology. So, one thing I want to reflect on, I'm thinking about a personal friend of mine. We're talking about 10 years ago, who was seeing a specialist that was hundreds of miles away. In fact, every time she had to go visit this specialist, she had to get on a plane. It was that critical. And the doctor went ahead and started meeting with her via FaceTime. And obviously, that's a very innovative, it's a tool. The doctor's probably thinking, I have it within arm's reach. She's an iPhone user. I'm an iPhone user. Let's go for it. Well, obviously, that is probably violating a variety of rules, if for lack of a better term. And I'm thinking about, you don't just grab FaceTime. You don't get on Skype or Zoom and meet with a client or a patient, I should say. There need to be some ways to do this right. And we've identified a few points here that I think we need to talk about: quality and reliability, getting that high quality stream out there with outstanding bandwidth and processing power, while also accommodating the speed and power departments, or where there's a lacking there. Low latency. We want them to be speaking to us in sub 5-second time frames. Security, and that's what I was referring to earlier with the mystery of FaceTime. We don't know where that stream is going and who may or may not be watching it. Although it's probably quite secure, it's not very manageable, and we're dealing with HIPAA. Telehealth certainly has to at least comply, if not beyond comply, with HIPAA. So let's just talk about streaming success requirements with regard to this framework. How can we nail quality and reliability? How do we do that?
Yeah, I think, quality and reliability largely comes down to just proper infrastructure selection and planning. So there's, if you're trying to stand something up, you need to understand your scale, understand how you're going to handle your load, and move beyond just day one, right? You might be able to get something to work immediately, but is it going to stay working a month from now, a year from now? How you maintain it, manage it, et cetera. So those are a few things as it relates to the reliability side. On the quality side, it's really about, I think, just best practice type knowledge, and then using that to, best leverage your implementation. So, there's different types of encoding that you could be applying to your video streams. There's different ways to handle your bit rates and making sure that your viewers are getting the best bit rates. So a lot of just kind of industry streaming best practices. And sometimes you might not have that knowledge in-house, but you can leverage and lean on people like Wowza who do have a streaming expertise to make sure that you're implementing it the right way.
Yeah, it's really taking advantage of the technologies that are available, following best practices, adaptive bitrate streaming exists for a reason. Knowing your audience a little bit, making sure you're covering things like people who want to participate in mobile scenarios, whether that be, now 5G or 4G, even 3G events, and kind of building your infrastructure and using technology accordingly to give them the best experience possible.
Definitely. And the next item, and I assume we're going to have a lot of questions on latency. I know better than to open up the Q&A channel myself, but we need to be having conversations that are active. You can't wait 5 seconds to deal with a latency issue when you're trying to communicate with your doctor or be monitored. So Barry, would you mind addressing just some low latency suggestions or technologies that may help enable success with virtual health?
Yeah, and and I think it's there's a couple of things, right? I mean, know when low latency is important, and leverage the appropriate technology for the time, right? So things like webrtc certainly give you very low latency and can provide that interactive experience. Um, within a closed environment, if you will, like in a hospital, and you're monitoring ORs or things like that, you have a variety of choices that may be more compatible with some systems and still achieve that low latency. So, be aware of what your needs are, be aware of what your infrastructure is, and Wowza can really help you with all of this from end to end, as well as driving out a relatively low latency stream for larger audiences, or more remote audiences that can be very effective as well. And that's, you'll see some of that when we talk about Angel Eye, and that the people tend to be viewing these things are remote.
Okay. And the next one I want to cover here is, it's a big one, and we can't understate it. In fact, we need to be very clear on how we approach security, because it's so important that our conversations with our doctor or medical staff are incredibly protected. And Health Information Privacy Act, it's something that covers all industries. While that HIPAA regulation is mostly procedural, making sure that you handle things in the workplace properly and other places, how do we really make this bulletproof, protecting data? What's the best way to approach this? Anthony, do you have any thoughts on this?
Yeah, so there's a lot of speeds and feeds items as it relates to security on what you can do and how your infrastructure is managed. Two things that I'll call out that kind of speak to both like a high and a low level angle of approaching the topic. Let's take user authentication. It's incredibly important that the person who is sending the content and the person who is receiving the content are exactly the people that you want to be accessing that content. That is, one-on-one. If you look at your example with FaceTime, they have the mobile numbers, which, kind of, yeah, maybe someone else has the phone though. Like there could be something on there, or you actually have the doctor's number later on. That doesn't, provide a lot of long-term, security for the doctor. There's some issues there with how user management is done that a proper infrastructure can solve for you. And then a different angle of looking at security too is just what you implement. And I'll just take the easiest one is, should you record the stream? If you choose to record all of your streams, all of that live video, then you have to now build out infrastructure for how you want to manage those assets, how you're going to authorize people into viewing those assets. Are they allowed to remove them or move them in other spots, et cetera? So then now you have to think about security in that angle. So another way to think about security at an even high level is, which types of workflows do we want to run? Because then you can scope your security around that specific implementation.
Makes perfect sense. Let's move on to some aspects where we've actually applied some of this. So we're going to go in and look at how we have used security, reliability, and even ultra low latency to support some of these use cases. And the first one we're going to cover today is a company called Angel Eye. The points we have here: with hospital visitation at an all-time restrictions at an all-time high, Angel Eye Health needed to deliver around-the-clock live video monitoring to families of patients in critical care. They needed low latency, high-quality video delivery to keep families connected, and it was very complex. And I'd love to go into this a little bit deeper. And which one of you here were more closer to the Angel? Was it Barry? Did you work with them directly?
I didn't work with them directly, but I'm certainly familiar with the use case. I mean, the initially Angel Eye was very focused on the NICU for premature babies and other babies that would wind up in the NICU for a variety of reasons. And there are many reasons why it's difficult for the families to be able to go and hang out in the NICU 24/7. Obviously, there's restrictions in the NICU itself, but there's also, families have other children. My own daughter was actually in the NICU for 2 weeks when she was first born, and we had another baby at home. So, you can't spend all your time there like you would like to. So, they provided the ability for virtual visits from parents and grandparents and whoever that, they've granted access. Of course, it's very restricted who gets to see what. But it's great if particularly now when they're not letting people in hospitals who aren't there to be treated, you know, it's nice to be able to bond with your baby um, over video, right? I mean, you can talk to them, you can see how they're reacting and things like that. It's a really cool product, and they've since expanded into both pediatric ICUs and regular ICUs, so that in the case again where you can't go see a loved one or patient, and now you can see them remotely. So it's very slick, and it's very efficiently done. They can handle many cameras, many sources. They've developed some cool technology to basically allow these things to stream on demand, so they're not wasting bandwidth, they're not wasting resources. So it's a very well done implementation as well. And they've been very successful with this, and I can see them continuing to grow.
Anthony, I want to ask you about a particular bullet, number 2, and you and I worked recently with a broadcaster on an ultra low latency, high quality workflow. What are some of the aspects with our products where we can actually pull it off? I'm thinking, often people will sacrifice quality for latency, but you'll say they needed both and they achieved both. What are some of the dynamics there that you might see critical when setting something like this up?
Yeah, so really defining your expectations for latency. So are you looking at real time, or a few seconds is the first path to go down to understand what types of technology you might want to use. But there's two real critical things that you can think about for quality and low latency. How much control do you have over the viewer experience is the first one. And so if you have a lot of control over the viewer experience, you can do things like make them use very specific player applications that can handle high quality and low latency streams. So you get good control over that. And another part of this is how confident are you in the viewer bandwidth? So if people are always going to be, plugged into the internet, hey, you can always rely on a really high bit rate getting to that viewer. Now, if you don't have those things, then you kind of get into, I would say, the second thing that I was going to mention, which is sometimes you got to play for both. Meaning, hey, you're going to have that high quality video because it's really important for the use that you're doing. But as a backup, you might need to make a lower quality rendition available. Sometimes this is an audio only rendition available if there's audio involved. And so this way you can kind of meet both of those needs of, it's really important to be low latency or real time. And then the second need of it's really important to be high quality. A lot of times you can hit both. And then sometimes when the end user experience can't hit both, you at least hit the real time. So like that's a good way to think about it in terms of understanding your viewer and how you might be able to implement with them.
Let's talk about Carbine. And this one is particularly interesting because it has to do with 911, and I can't remember on the fly, but I think it's been several decades, if not four decades or more, since the first 911 call. Probably 50. Barry, you probably know.
Yeah, I was there, Tim.
No, you were not there. You're just smarter than me.
He was the first caller.
Every once in a while, Wowza we'll have a trivia night or trivia day, and Barry's not the guy you want to go head to head with in a trivia thing, I'm sure. But no, I'm intrigued by it because they've merged 911 with video. Why don't you tell us a little bit about Carbine? What are we dealing with here?
So Carbine has modernized 911 emergency communication infrastructure. So like you said, it's built on, and folks are running this 50-year-old method to do 911 dispatching. and stakeholder communications, and they've modernized it to use smartphones and smart dispatching interfaces and ways to use the cloud basically to expand what is happening with emergency communications. And so they take a very unified approach, so they can do voice, which is probably what you're most familiar with 911 communications, but then they can also take data. So what's going on, where that cell phone is that's calling in, et cetera. And then video, they can even get video from the viewer. And I love this use case overall because I don't know, sometimes I look at my modern technology in my smartphone, I get mad at I don't know, just how it's sucking away at me for, playing too many, games on it. But then you look at use cases like this where modern technology is really making things a ton better for this scenario where, you can very quickly and properly identify where someone's located. You can quickly see what is happening. You can then communicate that out to relevant stakeholders the emergency response team that is getting on site so they know what they're getting into. There's just tons of really great ways that smartphones, the cloud is being used in this use case together to create a much better overall end goal of successfully triaging this emergency situation.
So is Carbine taking it to the next level? And I'll frame it like this. We probably see this in our local communities where somebody starts a Instagram page or a Facebook page that tracks happenings in the city. And usually it's user generated bad news, car accidents, fires, you name it. But it sounds like somebody smart took the technology and said, you know what, let's do this right. Let's put this in the hands of law enforcement. Let's give them the ability to see what's going on the other end. Is that essentially what it is?
Yeah, so they allow the dispatcher and other relevant parties to the call to see what's going on, but they also do other things with data to know what's going on in terms of geolocation. But another thing that they've just been really intelligent on building out the workflow is they essentially use a few different technologies. So with the voice communications, there's best in breed, call center technologies. And then with video, there's best in breed video technologies being used, and they're using Wowza to help capture the video. And they end up, within our Wowza streaming engine, they end up combining the two to create this kind of very clean experience for the dispatcher and for other stakeholders who are trying to see what's going on.
Barry, go ahead, please.
It's a really fascinating use of technology because it really is taking, as you said, Tim, it's taking some of the parts of stuff you see kind of haphazardly and really putting it together in an intelligent way, and a way that really is beneficial to everyone involved. The ability for someone making a 911 call to rely on video to relay information versus, they're going to be flustered. They're going to be confused. Maybe they can just point the camera at something and say, here's what's happening, please help me. There's a lot of reasons why this is a better way to do it. And as you said, 911's been around a long time and it hasn't really evolved. So this really feels to me like the future of where 911 should go. And I can certainly see them continuing to enhance it. We had a customer talking to us the other day about a very similar situation where it's like, hey, we want the first responders to be able to send a drone out to a scene and send that video back so we can triage and do what's appropriate before we send a bunch of people out there. So, layering on top of what Carbine has already been incredibly successful doing is really going to be some fascinating stuff you're going to see over the next 5-10 years.
Barry, I was going to ask you about this because I feel like these types of companies and institutions, however you want to frame it, are using these services. I feel like they're going to explode. They're going to be expanding into other states and other municipalities. How do you scale that? Like, what if you start out with the city of Baltimore, or you have Raleigh, North Carolina? I'm just pulling those out of the air. But what do you do when Santa Fe, New Mexico calls, and Boise, and all of a sudden you need to grow your business? What are some of the strategies that someone architecting a solution like this could have in mind as they just kind of think of these, these
I mean,
good problems to have.
yeah, I mean, of course, designing your infrastructure properly from the beginning to have a repeatable deployment model, right? So in Carbine's case, they can easily scale their system by leveraging what they've done in the past and expanding it to more servers and leveraging the cloud and things like that to take advantage of dynamic resources. Um, and they've done a good job architecting their system. And as Wowza continues to make improvements on our side, they can also support more streams with existing infrastructure. So it's kind of a win-win as we move forward.
So the next one I'm going to share a little bit about. It's a group called Child Health Imprints, and they approached Wowza and they wanted to create a streaming enabled platform aimed at reducing infant mortality for preterm infants. And the founders of the company actually, and unfortunately, were was a couple who faced actually losing an infant due to problems with the medical infrastructure. And so they came up with this concept of, and we've been talking about it all throughout this session, is where there's a shortage of doctors, a shortage of experts in demographics where there are gigantic populations and the ratio of doctor to patient is probably something extraordinary. But they decided to take that on and develop a platform that tracks data. We see in bullet point 3, there's clinical and vital data needed for monitoring. They want to synchronize that with video. And in order to do that, they had to have low latency, high quality. Here we go again, Anthony. Low latency, high quality video feed to support life critical decision making. And it needed battle tested technology. That's why you come looking in our direction. Wowza is definitely battle tested, literally battle tested, and engineering expertise to meet the requirements of regulatory bodies in the medical sector. So CHI, as we refer to them fondly, they approached us, and we built for them a architecture that uses webrtc, so they have that low latency playback. They have a specialized encoder where they're actually synchronizing data and matching data with what's being recorded. And the long and short of it is they have a solution that doctors can monitor from a distance and provide feedback to staff in the NICU. But they can also, and this is what's very interesting, begin to monitor things like how many times the infant was touched. They have AI that's artificial intelligence and machine learning, AIML, that's actually watching these videos and determining, when the diaper was changed, when the infant was touched, when the infant was fed, when the infant was, all those dynamics and all the things that the medical professionals are keenly aware on. They're aggregating that data, and they're already beginning to identify patterns, which can be reported up into the medical community. And they're actually saving lives because they're using this video monitoring component to determine, hey, if we touch the baby less frequently, their chances of survival, they'll sleep better, increases tremendously. And they all can also see that, particularly in Japan, where they're doing monitoring, that there's some of the practices they have in those NICUs, they can functionally, or they're actually learning from those doctors that the way they quote unquote do business in the NICU is better, and they can share that information. So I get really excited about it because Child Health Imprints is actually kind of this on the ground organization that's doing a tremendous job aggregating data, and their architecture is very centralized. They're using a major hosting provider, and they're able to keep the costs down so that the per patient cost is exceptionally low. So I think they're going to be really successful as they continue to grow their business with Wowza. So Barry, you helped me a lot with CHI. I worked with them directly. What were some of the things you might recall from us working together that you just might think might be worth mentioning in this setting?
Oh, yeah, first off, I was going to give you some props. I mean, Tim has spent a ton of time with this customer and really, really helped them from end to end. They came to us because their existing solution wouldn't scale. They were having problems with latency. They were having problems with costs. There all kinds of things. So, Tim helped them design and build a effectively a little medical device that is able to broadcast these high quality, low latency streams from the bedside, and dug into all the technology required on both sides, whether, and it wasn't necessarily, hey, put streaming engine on that device or put, something on that device. It was how can we put whatever works best on that device to get this in, and how can we synchronize the data, and then leverage the capabilities of engine to manipulate all this stuff. And the founding of this company is a touching story. It's an incredibly valuable thing they're doing. And, as the population of the world continues to expand in areas that are underserved, they can really make a difference in that infant mortality rate, which is probably a lot higher than most people realize it is. I was a little shocked when I read it the other day. So, really cool use case, great company, great product. I love the fact that they're leveraging advanced things, artificial intelligence, right? Detecting when a baby rolls over in the crib, understanding positions and actions and how they relate to that data. It's really fascinating, and I think they're kind of doing some really, really cutting edge stuff. So this one is pretty fascinating for me. All these use cases are.
Well, it was awesome working with them. And I feel, I'm not going to let myself take too much credit for this. My colleague Andrew Ramberg was just paramount to getting some of their encoders working. And in fact, at one of our all hands, our VP of marketing, Evan Paul, he talked about CHI, and there were a lot of us inside of Wowza that were working hard on this one. It wasn't an easy one, but it touches the heart, kind of to your point, Barry, where it's amazing that we are, we're involved with so many different aspects of streaming at Wowza, but when you get down to it, and when we're trying to help save the lives of babies and these newborns and these parents and all of the emotion in that, it really is fulfilling. I need to keep us moving here because I just looked at the clock and we're about 45 minutes in. I'm going to move to the next slide, which is what's next for virtual health. Anthony, I want to lean on you on a lot of these.
And Tim,
And let's just go through these. Yes, Justin.
I'm going to actually slow you down.
Oh, really?
Sorry. Yes, I'm going to post a poll here. I know that this is I think our next to last slide, actually. So I think we can maybe pop in
Sure.
a poll and some questions right before we end here with some thoughts about what's next. Is that okay with you?
You're the boss, Justin. You're the boss. As long as I don't get my hand slapped for going over time, we're good.
Well, here's the poll asking the questions. What streaming-based telehealth technology best describes what you're looking to implement or optimize? And the second question being, what's your biggest technical concern when streaming? So if people have a chance to answer this right now, that would be great. I wanted to pop in a few questions that had come in via email before we go into the questions that are coming into the queue. But if anybody has questions, again, please feel free to type them into the Q&A window. So one of the questions that was being asked is, if you need low latency for telehealth, what's the best way to get started? Do we have an easy entry way to start using low latency?
Anthony, I can tell you what I can tell you want to jump all over that one. What do you think?
Sure. When people say low latency, I'm just going to assume that they might need real time in this case. So we have an option with Wowza's streaming engine to deliver with real time right now. And so a simple use case is you might be able to just deploy this in your building. Maybe it's about remote monitoring some, cameras around the hospital, for example. And so this could be a self-deployed architecture. Wowza has a professional services arm. So if you're really new to streaming, that's a really great way to go in terms of getting them to help set you up. Other folks that are maybe looking for more cloud-based monitoring of, maybe similarly, it's kind of cameras in certain locations, and they're okay with some more tuned latency options. You can actually use all Wowza hosted infrastructure to deliver that to any viewer anywhere, use token authorization to make sure you're delivering it to the right users. So you have the security there for that, all kind of built into the managed service. So those are two options depending on what you're looking for.
All right. And that being said, I'm going to try to merge a question that's coming in by Terrence along with a question that had come in earlier via email. Terrence was saying, thanks for speaking on latency. I'm interested in what sort of minimum latency can be expected with WebRTC. Any thoughts? And that being said, someone else was asking about when it comes to like telehealth, which is better, using WebRTC or low latency HLS?
Barry, I've come at you with this question, proxying it from customers who really want to get down south of 100 milliseconds. And I know that's kind of extreme, but I want you to answer this one. What do you think?
Well, I mean, for the lowest latency for, given the constraints of what WebRTC can offer, WebRTC is going to give you the lowest latency. Now you're going to have problems sending WebRTC to hundreds or thousands of people, but for a one to few or one to one or even few to few scenario, by all means, WebRTC makes a lot of sense. Now there's going to be a lot of factors where you can induce latency into your stream. So depending on what the format of the incoming stream is, depending on what the format of the outgoing stream is, depending on whether you're using, multiple hops, whether you're using cloud server, local server. So you can't just say, oh, with WebRTC, you're going to get 537 milliseconds of latency every time. It doesn't work that way in real life. So, plan carefully, use the appropriate size resources, optimize your network the best you can, and you begin to dial down the latency. And our professional services group, we would be happy to help you with that. And that those workflows can be both engine and cloud, and a combination thereof. So you have lots of options. You have lots of places to go.
So that being said, as we moved into the next part of the question being WebRTC versus low latency HLS, I take it there's certain circumstances where you're saying we'd probably want to go with low latency HLS as opposed to WebRTC.
Yeah, I mean, as it's currently constructed, low latency HLS is going to be more efficient, more cost effective to scale to larger audiences in particular. It's probably going to be more device compatible across the board with a variety of viewing platforms. But you're not going to get sub-second latency with low latency HLS.
I think users should really think about their end viewers and how they expect those viewers to be, getting access to the video stream. If we go back to some of the customers we named, so Carbine is a good example. They actually have desktop applications to, so they have a very controlled environment to deliver with something like WebRTC. And when viewers are outside of that controlled environment, they would deliver with something like HLS. And so similarly, you might actually leverage both. I've heard this a number of times within the medical field where, you have certain people that need the real-time feed. And because of that requirement, they're going to access it on the right browser, or maybe there's actually a custom built desktop application with like a Chromium embedded browser for them to be using. So if you think through the end-to-end experience and start there, then you can kind of fill in the gaps of maybe which speeds and feeds technology is best served to hit each one. I wouldn't start on the choosing the right speed and feed at front. You should just, you start with the use case everywhere you're trying to hit, and then you kind of backfill it in. And certainly I think WebRTC is a really compelling technology for a telemedicine industry because there's typically small audiences and you can usually make some specific requests about the types of devices they view from. But you're going to also probably need to have other technologies involved in your workflow too.
And that is one of the advantages of picking something like Wowza to do that, because we're not focused on a single technology to deliver live video. We have a variety of ways to do that, and a variety of ways you can deploy that across the board.
Awesome. And I'm sure some of that relates to, what do you want to use for ingest versus egress? Sorry, Anthony, did you want to say something?
Yeah, I mean, it's important to call out, how you are encoding the video. What you're using as your source can drive a ton of latency. Some people don't realize it, but your source might be eating up a full second and you're trying to get sub-second. Well, there's a problem. So it is really important to choose the right sources for your low latency workflow.
I can tell you when I'm tuning a low latency workflow, it's so nice to use our encoder, our Clearcaster Pro, because I can go to you, Anthony, and you can go to your staff, and we can find out ways to really peel back the latency as we've done recently. That shouldn't be understated. That shouldn't be overstated, whatever. It's really important to have that control layer. It was a good question, Justin. Thank you.
No problem. If you don't mind, I'm going to just change the slant now to some of the questions. I got 2 questions, one from email and one in the queue, more relating to security. One being maybe what recommendation do you have for secure streaming? And I think that's probably related to HIPAA compliance.
I think user access management is probably the biggest thing that comes to mind. Depending on which technology you're using, sometimes transport's already is encrypted. So like webrtc has encrypted transport already. And if you're using HTTPS with a secure AES encryption, so there's encrypting transport, but then I think the user access is a really big piece to make sure that you are appropriately granting access at the right times, expiring sessions to make sure that they can't be used later, that type of thing for user access management to both publishing streams in as well as viewers being able to see the content.
All right. And one other question, it's kind of related to that. Kathy was saying insurance companies, while right now are open to virtual health, it's not been their practice in the past. Do you foresee this changing?
I mean, I think at the start we kind of hinted at this some. I think that there's going to be, patient or consumer demand, I think, for more of these services. In which case, typically, supply, the vendors are going to have to adapt to how their patients want to be seen and how their patients want to be cared for. So I would expect it to increase. I think that another angle of telemedicine is also just that being able to run operations more efficiently. And we're just seeing cloud-based technologies, data-driven technologies being used more and more heavily. And video as part of components within there is just a natural way to actually run efficiently, in which case a lot of these hospitals, operators, et cetera, like it makes a ton of sense to invest in technology here to save in other resource and other ways.
I mean, as the insurance companies want to drive down costs and things like that, as Anthony said, investing in these kinds of things actually makes things a lot more efficient. My insurance company has been in, and I think Tim hinted at this too, they've been driving us this way. And even before the COVID started, you've certainly seen them encouraging remote medicine and telehealth, largely due to the efficiencies they can drive from that.
All right. And Tim, I think this is a good segue into our last slide.
Okay. Well, let me bring that back up. We'll get back on track. So let's talk a little bit about what's next for virtual health. HIPAA compliance for cloud deployment. Cloud service providers must prioritize security to avoid potentially expensive HIPAA violations. So we're going to see HIPAA compliance for cloud deployment increase. Streaming enabled wearables. This one is very interesting. I'm hearkening back to the excitement over Google Glass from 5 some odd years ago. with wearables taking over healthcare, video and IoT, Internet of Things, will collide to produce streaming enabled wearable devices. And perhaps this will go beyond just the operating room or something happening in an examination room, but maybe we'll wear something that transmits data back to the people tracking us. Barry, didn't we recently speak about how telemetry can be pushed back from maybe a wearable device?
And the cool part about this for me is these wearable devices, or whether they're truly wearable or just mobile focused devices. They collect a ton of data, and you're seeing this with some of the stuff Carbine's doing, right? They're getting the GPS information from your phone to show locations. My watch tracks all kinds of stuff. It's like I should, if I needed to stream from my watch something going on, it can also transmit all that underlying data, my heart rate, my atrial fibrillation, whatever it needs to stream. And that's a lot of valuable data you could stream either in a 911 scenario or just within a hospital. I like your Google Glass idea for a surgeon wearing Google Glasses while he's teaching other people how to do that operation. You're getting the firsthand view of what he's looking at versus what the camera operator might think is important. So there's some interesting stuff there for sure.
It's like I've fallen and I can't get up, and the person on the other end says, "I know, and you also drank too much last night." That's not funny, but I couldn't resist. Skyrocketing adoption. I'm thinking, Justin, about the insurance question. How some insurance companies don't like the telemedicine, or perhaps haven't quite gotten their mind around it yet. We think it's going to become more of a demand. People are going to look for opportunities where they can go into the doctor as physically and as infrequently as possible. This one's fun. And it's also, people get scared of AI, but AI on the other hand just presents so much accuracy and so much consistency. Artificial intelligence acceptance. I think we're going to be a little more comfortable when we realize we're not necessarily building Skynet here. Any comments on AI?
At the end of the day, a lot of these things just come back to the patients, and are you helping them stay healthier? And if AI is a part of that process, it's going to be accepted. The idea of even cloud-based care, remote wearables, am I going to be able to recover better? In some cases, being at home is much better for a person than being isolated or somewhere in, a healthcare facility when they could be at home if a certain few things were in place. So, a lot of this to me just comes back down to, what's the ultimate goal of healthcare and virtual health, that part in it of just providing better patient care, and AI, 100%, it's part of it.
The AI stuff is really interesting in the medical field, is applied to some big data scenarios, right? So, there's a ton of medical data out there that probably never gets cross-correlated, right? So, maybe you're doing a cancer study among 1 million people, and that you have 1 million data points that maybe somebody's looking at 500 at a time. Dump all that into some AI analytics engine and do some deductions based on that incredibly huge sample set. And, you could really make some breakthroughs that way. So I think particularly in some of those areas, and even to the point of, analyzing images, looking at what people might miss, things like that. I think it's, there's a level of consistency that you could at least bring things forward for a human to double check. So I think there's a lot of really interesting applications of AI in the medical field.
And I'm constantly amazed at how we've been able to demonstrate AI technology in areas like security and surveillance. And obviously it applies with monitoring and medical. But what's remarkable to me is how certain AI APIs from companies like Microsoft, you can tell a computer to watch your screen and provide you with feedback, and very specific feedback. And I think it's going to be something we continue to see more integration of on the streaming side. Tighter cyber security. Successful solutions must encrypt. They will encrypt confidential data and to meet state, federal, and international compliance. As those standards become more standardized and states are doing what other states are doing, and we become really good at this, I'm certain we're going to see some tighter cybersecurity. I just had a question. It was really more when we were doing Q&A earlier. Does DRM ever play into this type of scenario with medical, or is that primarily just a broadcast solution? I was just curious.
It could. I mean, there's various ways to actually encrypt the data in a stream to make sure that not only that the transport is secure using TLS, but also the underlying data. And particularly when Anthony earlier was talking about recordings, you may very well encrypt some of this data while it's at rest on disk. post recording, and not rely on just your underlying operating system security or things like that for your file store. You may want to make sure that you've applied something to these assets, and DRM may be a candidate there.
I was just curious. I know DRM, and we've dealt with it to a large degree with particularly Hollywood when they're screening movies via video streaming. It's just so critically important that precious data is just not proliferated out into the wild. And I'm assuming the same thing applies with health. But sometimes, the one industry will be much better at a certain aspect of security than another. And one thing we see as kind of a do-it-all solution, which is what we do for streaming, we may see something that is really effective, maybe in the military space or law enforcement, or and I'm referring to Hollywood, that we could potentially apply to a medical or virtual health use case. So these were great questions. Justin, did you have any other feedback before we draw this to a close?
I've got questions.
Well, I think we should do a couple more questions, and then we should probably take a look at the results of the poll. So I'd love to turn it over to you to see if you have any other items for us.
So one question that we had that came in was, how do you foresee 5G impacting telehealth, and how will Wowza support those capabilities?
I mean, so Wowza support for 5G is really just all benefit, because it's really about just the bandwidth to move data and video around more efficiently. In terms of its impact, it should lead to easier accessibility to video, which is really big and hard to move around the internet. And so that means that, patients who are on cell phones will have an easier time receiving video or sending video themselves. It also means that the video that you can send can be sharper, like higher resolution, higher bit rate, in which case you might be able to better diagnose from those images. And so there's both that kind of quality and accessibility that really should help with 5G.
All right. And the last question that we have in the QA window was Ishwar was asking, trying to read into it a little. He wants to basically know how to get up and running for a doctor's office to start doing virtual checkups. What do you need to get started? What's the technical requirements? And I think he's talking about, he says, okay, let's say I have our Wowza streaming engine and we have a good internet connection. What else should he be thinking about?
Sure. I mean, if we make a lot of assumptions, we could assume that this facility actually has really good access to the public internet, and all the patients are just in the nearby neighborhood. There's some potential you could run a server and handle one-to-one chat, kind of all from your homegrown office right there, and maybe do some access management with just unique hashes for each patient visit. This way, you're always secure. You're always sure that that conference is only for that patient, and only that patient's going to be viewing it. So you could do a few things like that. I think most people probably don't want to go the route of hosting something on site, but some people do prefer that because they feel like it is more secure. Everywhere the video is going in that case.
All right, and that's it for our questions.
Great. Well, we're going to go ahead and wrap up here. If you would like to go deep on any of these items we've spoken about, or if you have questions or you're interested in leveraging Wowza products and services, you'll see on the screen, you can call us toll free at the 888 number right there. Reach out to sales@wowza.com. I assure you, our sales staff, they're very friendly, and they will connect you to somebody who can answer your question if you have one. Take a look at our pricing at wowza.com, as well as our support options. Again, I want to recognize Jason Tukler and Mac Hill, who've been answering questions on the side. We've talked about low latency a lot in this particular session, and if you'd like to give it a try, go ahead to wowza.com. You may or may not be able to write down that URL that you see on the screen there, but if you dive into our website, do a quick search for webrtc, We can get you a trial license. We can get you up on cloud and get you exploring some of these ultra low latency technologies and some of these very convenient technologies. For example, we didn't even touch on it, but you can actually use Wowza Cloud to broadcast from your browser, and it's all integrated. So we have a lot of great solutions here at Wowza. I want to say thank you to our panelists, Barry Owen, Anthony Lazaro, and Justin. Thank you, everybody. We had a great time this morning. I should say today, because we're all over the world. We're just really, really glad to be here, and thanks for watching.